Houston chiropractor, Dr. Gregory Johnson, and today we're coming with you about a patient who actually watched our YouTube videos on hiatal hernia, and she drives over an hour here to see us from where she lives in Texas. And I'm going to show you specifically, I've already done her adjustment, but I'm going to show you specifically how to work on the hiatal hernia that pulls the stomach down through the weaker diaphragm that we've now strengthened up by lining up her mid-back and rib cage. But we're going to pull her stomach down through there so that she can get that acid reflux under control. Take a deep breath in for me, Jeanette. There you go. Let it all the way out. Now, you want to go below the xiphoid process, and you'll feel the stomach, and you pull it straight down in the z-axis and then also down on the y-axis. And you always want to make sure you're underneath of that xiphoid process. There it is right there. That's the top of the tummy. Now the patient will usually feel a little gurgle or even a pulse. One more time. Let it all the way out. Very good. Now also, when we do this, a lot of times you'll find that there are valves that get stuck, especially over here on this right side. This is the ileocecal valve, and that gets a little stopped up if you eat popcorn or peanuts, things like that. They have a husk on them, corn, and this is the valve between the large intestine and the rectum that gets stopped up on the right side. And you can kind of do a soft clockwise and feel that tightness right there. In the colon, and the patient will usually have a bowel movement within the first 12 hours of doing this, so this is an excellent treatment for constipation as well. Now here, what I'm doing is called transverse friction massage on the tensor fascia lata muscles. Those are tender, aren't they?
Yes.
Yeah, you didn't have any problem saying those were tender, because most people do. That's all right, you can say it the way it is, because they are very tender. But these are neurologically connected to the colon, and when we stimulate these, it will stimulate the L3 nerve within the lumbar spine, and it will actually help us to get a better response off the L3 nerve. Now, I pulled her stomach down through there, and we have worked on the muscles in her tensor fascia lata area that are connected to L3. Now what I'm going to show you is something we use on patients who have had a lot of chronic back pain and muscle spasm, and we're going to show you how to use a TENS unit. So let's turn on your stomach, and we'll put your face right down in there for me. Now, we don't do this kind of therapy in our office just because you can do this at home. So what I'm going to do is, where's the alcohol wipes? Okay, usually want to clean this area with alcohol so it doesn't get on the oils of the skin, but her back's pretty clean. I can't find the alcohol rubs right now, so we're just going to show you how to put these on. This is a TENS unit, model 3000. It's very strong. It provides a electrical current in different modes of modulation, which you control right here. This is provided by physicians preferred providers out of Tampa, Florida, and you can have 3 different modes, and I'm setting it on the end one, which is continuous mode, and I'm putting it for 30 minutes, and I've got it at its maximum frequencies. So we take this and we hand it to the patient in the front. If you can just hang on to that for me for a moment, please. And you notice there's a left side lead and a right side lead, and they have a red and black connection on each side. So we're going to take the left side lead first, and we're going to put a black one right here. Now, you want to make sure that it's not on the bones or the spinous process of the spine. You put it right to the side where the paraspinal muscles are. And then you put the other lead from that left side exactly opposite of that, again on the muscles to the side, not on the bones themselves. And you see those are right next to each other, only about 1/2 inch apart. And that's from the left lead. Now you take the right lead and do the same thing, but this is very important. See, I have the black lead on this side, left side over here, so on this side, I'm going to put the black lead on the right side, directly diagonally from that. And the same thing that you do with the black one, you do with the red one. So we're going to take the red one on the right side and put it diagonally across from this red one. So you've got a kind of a figure eight or infinity type of reaction that goes on. And then here on this, let's go ahead and let you do this so you can see. You want to always let the patient do this because that way they can feel it better. You want to just turn that clockwise until you feel the electrical. Don't do it too quick, you'll shock yourself. Yeah, and then do the other one where you feel it. There you go. Now you want to turn it up to your maximum capacity of tolerance. So turn it up to where you feel it really strong, it feels real strong. And then you want to turn the other one up to the equal size so that they're the same strength from side to side. Now after she's worn this for a few minutes, she'll actually get used to that and she'll be able to turn it up to her next tolerance level. What this does is it fatigues the paraspinal muscles and then they relax. It also blocks the pain messages from this area of the spine going up the spinal cord into the brain, so it provides a function basically by improving circulation in the area, making the muscles relax, and you stimulating the muscles, contraction, relaxation, and it blocks pain impulses. So transcutaneous electrical nerve stimulation, or TENS unit, is what we call this. And do you feel that? Can you crank it up a little bit more now? Now she cranks it up now to her new tolerance level, and she just continues to wear this. I preset this for 30 minutes, so it will go off automatically within 30 minutes. Then you just turn it counterclockwise and turn the battery off so that you don't get shocked again, plus it saves the battery. And this is something we give patients to use at home, or when they've had chronic back problems or pain or spasm. You can use this in the low back, pelvis, mid back, upper back, neck, shoulders, knees, elbows, anywhere you're having pain and inflammation. So this is your Houston chiropractor, Dr. Gregory Johnson, and we'll see you next time.